For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Diabetes is a growing issue in the United States, and especially in Louisiana. Today we have Terry Compton, Diabetes Education Manager at St. Tammany Parish Hospital, here to talk about symptoms, diagnosis, and management of diabetes. Welcome, Terry.
Thank you.
I guess first start with telling us what diabetes is.
Well, diabetes is a condition where your pancreas is not able to make enough insulin, or your body is resistant to the insulin that your body actually makes. So when we think about what diabetes does, is our body has to have food or fuel to function. And we have a problem with that imbalance where our body's not able to utilize our food or fuel very well because our pancreas is not able to process that, or maybe not able to make enough insulin over time.
Okay. I know that there are 2 types of diabetes. Can you tell us the difference between type 1 and type 2?
Well, type 1 is where the person is no longer able to make insulin at all. Insulin is a hormone that's made in our pancreas, and it's a hormone that our body has to have. So when we cannot make insulin, our body then becomes deficient, and the person becomes very, very sick. So type 1 diabetes, that person requires insulin by injection. With type 2 diabetes, the person's body still makes some insulin, but they have the capacity to manage enough to where they don't get extremely ill, as if with someone with type 1, where that can be life-threatening if they don't have insulin at all.
Okay. And what are some risk factors for type 2? I know type 1 is genetic, correct?
Well, there is a very strong component that goes with genetics with type 1 diabetes, but usually with type 1 diabetes, there's some sort of autoimmune destruction within the cells of the pancreas that produce that hormone insulin. But with type 2 diabetes, there is a much stronger genetic predisposition for diabetes. So if you have relatives, a father, mother, brother, sister, aunt or uncle, grandparents, it puts you at higher risk for diabetes. So that's one component. Typically age, we look at people that are over the age of 40 are at higher risk for diabetes. People that are overweight, and when I'm thinking of being overweight, just not extra pounds, but having what we call that visceral fat, that belly fat that comes around the center, because it makes our body work harder, makes our insulin have to work harder to overcome that resistance that's related to having the fat in our body. So people that are overweight as well. We see it also in certain ethnic groups that are higher proportion, typically African Americans, Hispanics. But as we get older, as we age, we are seeing a much older population, aging people, 60s, 70s, and 80s, getting also type 2 diabetes because they're living longer as well.
Okay. I guess for someone who may think they have diabetes, talk a little bit about the symptoms and how you would maybe even start to think that you have it.
What's interesting is we do group classes, and we always have the discussion with people, how do they find out they had diabetes? And many times it's just related to annual labs. But then when they go back and look, they may think about, well, I have been tired for a while. So fatigue, feeling tired is a very common symptom. Maybe increased thirst, increased urination. Well, I've been working out in the yard. A little bit, that component. So they don't necessarily relate the increased thirst, the increased urination, or even feeling tired as one of those common symptoms. Having blurred vision. Man, I need to go get some new glasses. Things just don't seem like that I used to see them before. Having a wound or a sore that just doesn't quite heal as well. So they may get a cut on a foot, and then they just realize it just takes longer for that to get better. So typically what happens is that someone will end up going to their physician for another problem, and the diabetes tends to be discovered. So that's how we see a lot of patients now being diagnosed with diabetes, is through annual labs or going for a checkup.
Okay, so a lot of the symptoms aren't noticeable. You don't usually notice like, oh, this is probably diabetes.
It could be very insidious, and people tend to throw things off like, well, maybe it's just not that big a deal, because denial certainly is a good way of not having to face the reality that there could be something really seriously wrong, and then having to deal with the outcome. And what am I going to do if I find out I have diabetes?
Right. Well, what can happen if people go undiagnosed or untreated for diabetes?
And that's an unfortunate thing that I also see here when we're taking care of inpatients, is the complications that come from the management, or maybe the lack of management, of diabetes. The majority of the hospitalizations, the complications are coming from having diabetes, even though they're coming in the hospital, say, with a heart attack or a stroke. There is a very strong correlation. If someone has heart disease, we look for diabetes. If they have diabetes, we look for heart disease. And what we have found is that the blood glucose, the thickening or the sugary component of having high glucose in the blood, damages the inner lining of the walls of our arteries. And so it makes them less pliable. They don't have the flexibility. So people now have high blood pressure because their arteries aren't squeezing the blood, moving that blood. And it also puts that patient for high risk for a stroke and also for a heart attack. So when we're seeing people coming in having bypass surgery, we see that they've had diabetes for a long time, or a recent stroke, they've had diabetes for a long time.
So it's something that can cause a variety of other problems in your life besides just, well, the insulin production, but
Right.
it can cause other diseases, in fact.
And so when they are told that they're now going to have bypass surgery, the reality is they now have to take care of their diabetes. It's something that they can't ignore, because ultimately, even if we impact the change in their blood flow to their heart, if they don't manage the blood glucose, it's still going to cause future problems. We do see other complications from diabetes that are just as debilitating. Chronic kidney disease, which also affects, diabetes affects that, because our kidneys are a filter. And our kidneys are supposed to reabsorb the glucose back into our blood. And unfortunately, glucose damages those arteries and the filters of our kidneys and allows protein to spill into our urine. And that protein ultimately is a bad sign of how progressive the diabetes has gotten. And so that's another big problem we have. And we see a lot of people now on dialysis as it relates to having poor diabetes or having hypertension and diabetes at the same time. Eye disease, it's a very problem with blindness, because especially with people with type 1 diabetes, over time it ruptures those small vessels in the back of the wall, and so those retinal bleeds, those bleeds that occur in the eye, then cause blindness as well. So just besides you're thinking of just having high glucose, the high glucose is what causes all of the other problems, the heart disease, the kidney problems, the eye disease. And ultimately, one of the other common issues is peripheral vascular disease, where it affects the circulation in the lower limbs. So people don't get the adequate circulation. They get a cut on their foot. It doesn't heal well because they don't have the nutrition that's going in the blood circulating to the lower limbs. They don't have the good wound healing because they have elevated blood sugars. And so they end up getting ulcers or some sort of wound on their foot that may get more progressive. They also have nerve damage from having these high glucoses, and they don't even have the sensation of when they're injured. And so eventually they may end up having a more severe injury to that foot because they've stepped on something and didn't realize it until it got so severe. So that's what also leads to amputations or other chronic wounds that don't heal well. And again, it's all related to sugar. That blood sugar is what causes all these other complications.
Wow, I feel like that's not something people would normally think, that, you're like, oh, diabetes, just eat better, do whatever, but it can lead to so many other problems throughout your life.
Absolutely. And so what we're seeing in the hospital are the patients that are having the complications from diabetes. Oh, they happen to have diabetes, but they have heart disease, kidney disease, wounds. And then we're all trying to fix all the other peripheral problems, but what it all comes down to is the glucose management.
Right. So as scared as people might be to get that diagnosis, you should be more scared of not getting the diagnosis and not treating it.
Absolutely. And I think that's a very strong point, is the reality, because when people hear the diagnosis of diabetes, they get scared. And the one thing that they don't want to have to do is make change. And change is one of the biggest things that helps to make some differences in what you do. And those changes, obviously, nutrition is one of those first-line therapies, and what we actually eat has an impact to our overall blood sugars.
Awesome. Well, we'll be back with you in a minute. We'll be right back with Terry to talk a little bit about those changes and managing your diabetes once you get a diagnosis.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We're back with our guest, Terry Compton, the Diabetes Education Program Manager at St. Tammany Parish Hospital, to talk a little bit about once you are diagnosed with diabetes and how to better manage your health. Welcome back.
Thank you.
I guess let's start with some suggestions for someone who has been recently diagnosed with diabetes.
Well, because I'm a diabetes educator, I really feel we can have such an impact on their overall care. With our primary care offices, we have a diabetes educator that's available. So if you are part of our St. Tammany network, our physicians will refer you to us to have that one-on-one initial education. Part of it is understanding what you really need to do, and it is a lifestyle management change. Many times we are looking at what we can do differently. So nutrition is usually the first thing that we consider, as well as including or increasing physical activity, and of course medications, because medications do have a really big role in how we're trying to change that glucose, that initial glucose, when people are first getting the diagnosis. There is a test that helps kind of give a report card about how our diabetes is doing, and it's called the hemoglobin A1C. And someone who is newly diagnosed with diabetes, it would be at least 6.5% or greater. So when you have that lab test, if it's greater than 6.5 or equal to that, you have diabetes. And sometimes it's hard to convince people just because of one lab that's drawn at one time, they have the diagnosis of diabetes. But when they get referred to us, we do an initial assessment to really figure out how we can make change in their daily routines and incorporate nutritional changes. And so we try to tailor and individualize a plan for you. It's not one size fits all, and so that way people can understand. We find that people don't eat breakfast regularly. They skip lunch. They go go to fast food places just because that's convenient. They may not cook in the evening because they live alone or may not have transportation to go to the grocery store, or even have the money to buy the groceries that they feel like they really need. So we have to look at what the issues are related to that one person to try to make it work for them. And then explain to them as well, what we can do to help them. Many times they have no concept of really what foods I can eat. The most common comment I get is, well, I can't eat anything white. And I say, well, why do you say that? Well, that's what I've heard. You hear that on the media. But it's not necessarily what's white. It's really the portion or the serving size. And really how we define a serving size is really what is really one choice or one carb serving. And so people really have to look at the total amount of carbohydrate they're eating in a day so that they can help manage that. Because carbohydrates are the foods that actually directly affect how our blood sugar goes up. And so when we're looking at types of carbohydrates, we're looking at starches and grains. So that could be a white piece of bread or wheat piece of bread. It could be pasta of any kind. It can be cereals. It could be a potato. So there's lots of foods that fall within the starches and the grains. It can be fruit, and it can be anything that's in the milk or dairy group. So really most people don't have the concept of what is a serving or a portion size so that they understand how much to actually eat. We plate our food, we come home at night, we fix our food, we put it on a plate, but we really have no idea how many actual servings of total carbs that we actually eat. And so that sometimes is a little eye-opening for them because they realize they're actually eating too many carbohydrates that could have impact their blood sugars. And so with type 2 diabetes, we're looking at a little bit reduction or some sort of restriction in the total carbohydrates that they have at each meal. So if they're taking medications, we can see how it impacts our blood sugars over time. We want people to eat 3 meals a day. We don't want people to skip meals. And we want to have them eat about the same amount of food so that they don't have these huge blood elevations in their blood sugars because they've eaten too much carbohydrate versus too little carbohydrate. And then they don't feel well because now their blood sugars are spiking or going up, and they're not able to respond to that because their medication may not be working.
Right. Well, and you mentioned medication. I know, I'm sure a big fear for a lot of people when they first get diagnosed is, am I going to have to take insulin shots? But I know from my experience with people in my family and stuff, that's not always they don't always automatically have to start doing shots right away.
No, and it really looks at how elevated the blood sugars are. Unfortunately, diabetes is a very progressive disease, so if you have had diabetes for some time and didn't even know it, your pancreas may not be able to produce enough insulin. So when we see people live with diabetes 15, 20 years, they may require insulin over time. But there are a lot of first-line medications. All the pills that people take are not insulin.
Right.
They work on different parts of the body to help our body utilize our fuel, our glucose, differently. And so the most common medication we see is metformin or glucophage. And so it's a very inexpensive medication, but it actually works on our liver. It has nothing really to do with our pancreas. It works on our liver. And there are other medications that make our pancreas make more insulin. There's medications that make our body use our insulin more efficiently, work better in our bodies. So we have to look at it in a kind of a tiered approach. Our pharmacist kind of describes it as more as an Army, Navy, Marines approach. You have to kind of look at it from different ways to see how we can have an impact on the overall glucose management. And there are no meds that are not without side effects. So our role is to help people understand how to take their meds more effectively so that they don't have any side effects or problems related to taking medications too. So if they have to progress the insulin, then we can help them understand how to tailor an insulin regimen for them on a daily basis and do glucose monitoring and include nutrition for the whole picture.
Right. Okay. I know in Louisiana, a big thing that we do, we get together with family, friends a lot. We have a lot of parties, holidays, football season, things like that. And at those types of things, for anyone, whether you have diabetes or not, it's temptations. There's a ton of food. Most of it's not healthy. And people are just eating all day. I know at our family parties, we just eat all day. It's not, a mealtime thing. So can you talk a little bit about kind of dealing with those kind of things, especially when you have diabetes and you're trying to manage it and stay healthy?
Well, I think that is the biggest challenge because no one wants to be deprived, especially when we have getting ready to have football season and then we roll into the holidays with Thanksgiving and Christmas. So the hard part for people is to really understand what can I eat and being able to incorporate that. And I think when they sit down and meet with our dietitian, nutritionist, is to really see food for what it is. Food is really fuel for our body, and so we can make better choices and looking at really those serving sizes so that if we want to have the hamburger or the hot dog, certainly we can have all that, but we have to look at the whole aspect of how many and then all the sides that go along with that if we're going to do that during football season. So it's just a question of helping them understand what they can have. Really, there is no really forbidden foods. I mean, concentrated sweets really don't have a whole lot of nutritional value, but it's not that we can never say you can't ever have anything sweet again. Sugared beverages like sodas are really not something we recommend at all because there's really no nutritional value. And a typical soda, like a regular, I don't want to put a particular brand, but any regular soda is the equivalent of eating 3 slices of bread. So if you have a regular soda, 12-ounce can, that's like eating 3 slices of bread. And so when you put that into perspective, most people are like, really? That's how much I'm actually eating by drinking those calories in a particular soda. So it makes people really realize that maybe that's just not the best choice, and maybe I need to reconsider something else. So it's just helping them understand how they can incorporate favorite recipes, looking if they're going to go out, looking at the whole picture, what can I really have out of this that I really want, and then having a little bit over throughout the whole day, then making this huge pile of plate when they first sit down to eat.
Right. Well, and you've been talking a lot about portion sizes. Can you give us kind of some general, how much meat, vegetable, carbohydrates you should have on your plate at each meal or throughout the day?
Well, there's There is one way that kind of helps. There is called the plate method. If you were to take a 9-inch paper plate and look at the plate, if we divide half of the plate, this should be like non-starchy vegetables. So that could be any salad items, whether it's cooked or raw. Could be any sort of vegetable that we like. It could be broccoli, cauliflower, cucumbers, lettuce, tomatoes, squash, peppers, mushrooms, you name it. There's lots and lots and lots of vegetables. So half of the plate should be non-starchy vegetables. A quarter of the plate of that 9-inch plate should be a protein, so that could be any kind of meat that you choose. And then the other quarter of the plate should be our carbohydrate choice. So that could be our starchy vegetable. And then we could add 2 more carbs or carb choices, such as a fruit or a milk, to make a balanced meal. So when we're looking at most people, they would require about a three carbohydrate choices in a meal as an average meal, just in general, if we're trying to looking at making it more healthy. So half of the plate's non-starchy vegetables, a quarter of the plate is a protein, and then we can add 3 other carbohydrate choices with a variety of things to get the nutrition we need.
Right, so you don't want to have, if you say in 3 carbohydrate choices, you don't want pasta, potatoes, and more pasta. You want,
Well, yeah, that wouldn't be the best choice.
Right.
But you know, some days, if you really want the spaghetti and meatballs, sometimes you have to kind of, you know, make some choices if you want 2 servings of pasta with your sauce and then your meatballs, whatever. So yes, but that's the best way that people can learn how can I enjoy food but still have that what I like, but not overeat when we're looking at the big picture.
Okay, and very quickly, can we talk a little bit about gestational diabetes? I know that can often lead to diabetes later in life for mothers, and so.
Well, when a woman is pregnant, they do a screening with a glucose tolerance test during a certain period during their pregnancy to see whether their blood sugars are elevated. And there are parameters that are guidelines in terms of diagnosing gestational diabetes. So if the glucose is elevated, then we do know then that woman is having some challenge where her pancreas is not able to make enough insulin, or she's having some insulin resistance during her pregnancy. And so with gestational diabetes, the first line is really nutrition. We want our mother to have enough calories to give what she needs for the growth of the baby, but we also want them to be spread throughout the day so that we don't get these huge surges of glucoses throughout the day. And so we really have a very tailored meal plan for that mom so that she can balance out the nutritional requirements throughout the day. Sometimes women require medication, including insulin, during their pregnancy. And I have never seen a more determined group of women really follow what they need to do is when they're pregnant, because they really want a healthy outcome for the baby. Unfortunately, if women have elevated blood sugars, that glucose goes to the placenta, goes into the baby, and of course it stimulates the baby's pancreas to make insulin, and it makes the baby grow. And so we have these huge infants that may have issues during delivery and poor outcomes to that infant later if it's not managed correctly.
Great. Well, thank you so much. I think this is all great information and very important for our community. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.